Right now, the most revolutionary medical tool being developed isn't a robotic scalpel or, a miracle drug.
Yeah.
It's actually a digital assistant that's trying to basically destroy that awful clipboard you always have to fill out in the waiting room.
Oh, absolutely. The reality of healthcare for most people, and honestly for most doctors too, is just notoriously slow. I mean, you go in feeling terrible,
Yeah.
and the very first immediate barrier to getting any help is just this massive administrative bottleneck.
Yeah, you fill out the exact same medical history you filled out, 3 years ago? You hand it to a stressed out receptionist, and then you just sit there and wait.
And you wait and wait.
Exactly. But today we are taking a deep dive into an article from AI 365 dated June 18th, 2026. The headline explores Epic generative AI tools and how Epic Systems, which is this massive healthcare software company, is really trying to demolish that sluggish reality. We are looking at roughly 200 generative AI features currently in development to completely overhaul the medical system.
Yeah. And Epic is uniquely positioned to actually pull this off.
Yeah.
They aren't just some scrappy Silicon Valley startup trying to disrupt the industry from the outside. I mean, they are the infrastructure.
Right, they're already everywhere.
Exactly. A massive percentage of major hospitals already run their entire electronic health record systems on Epic software. So when they decide to integrate AI, it has the potential to touch millions of lives almost immediately.
Our mission today is to explore how these tools, specifically 3 AI assistants named Art, Penny, and Emmy, are meant to revolutionize clinical workflows, billing, and patient engagement. Because they are essentially redesigning the healthcare experience from the doctor's office all the way back to your living room.
It's a total paradigm shift.
It really is. Okay, let's unpack this. Because before we can actually trust these AI assistants to handle our medical lives, we need to understand the foundation they're built on. Like, where is all this AI brainpower actually coming from?
Well, the underlying engine is what makes this so significant. Epic is leveraging its own massive research database, which is called Cosmos.
Cosmos, okay.
Yeah, and to give you a sense of scale here, Cosmos holds over 300 million patient records.
Wow.
I know, it's huge. It encompasses more than 16 billion individual medical encounters across 4 different countries.
16 billion encounters. That is just a mind-boggling number. I mean, to put that into perspective for you listening, it's the difference between training a standard AI just by having it read, medical textbooks versus training an AI on 16 billion actual real-world doctor visits.
Yeah, it's the difference between having book smarts and having street smarts.
Exactly. Because the AI knows how a textbook disease is supposed to present, right? But it also knows how that exact same disease actually looks in a 60-year-old patient who also has like 3 other underlying conditions.
Precisely. And Epic's strategy here isn't to build some experimental sandbox. Their focus is entirely on practical, measurable outcomes. To pull this off, they are actually partnering with Microsoft.
Oh, Microsoft, really?
Yeah, they're specifically building these models on Microsoft Azure because that cloud infrastructure provides the latency-free scalability needed to deploy this stuff across massive health systems. You obviously can't have the hospital's computer network freezing up while the doctor's right in the middle of trying to diagnose you.
Oh, definitely not. But wait, with 16 billion records feeding this machine, there has to be a massive privacy risk for the patient, right? If I'm listening to this, I'm definitely thinking, are these models just reading my personal, deeply private medical diary to get smart?
What's fascinating here is how Epic solves that exact problem using something called synthetic data.
Synthetic data, what is that?
Yeah, so they use the massive real-world data in Cosmos to generate completely fake or synthetic data for testing.
Wait, fake data? How does the AI actually learn anything useful from a fake patient?
Think of it like training the AI for a self-driving car in a highly realistic video game, something like Grand Theft Auto. The car learns how to navigate complex traffic patterns, weather conditions, and avoid unpredictable pedestrians perfectly in the game. But if it crashes during the simulation, nobody in the real world actually gets hurt.
Oh, I see.
So in the medical context, the system analyzes millions of real records to extract statistical correlations, like how a 60-year-old diabetic's blood pressure typically reacts to a specific medication. Then it uses that math to generate a brand new, statistically identical profile.
So it's basically building a digital avatar that perfectly mirrors reality, but it completely strips out all the personal identifying information.
Precisely. There is no name, no social security number, no actual human attached to it anywhere. This allows Epic to rigorously test the models and validate the AI's clinical logic against realistic patient scenarios without ever exposing a real person to a privacy breach.
Okay, which is huge. It keeps everything strictly compliant with hypo. Which, for anyone listening outside the US, is the incredibly strict federal law protecting patient health information. So you basically get the statistical lessons without the personal liability.
Exactly.
All right, so the AI has been trained safely on this massive foundation. Now we put it in the room with you and the doctor. Currently, the exam room is a space plagued by severe clinician burnout, mostly because doctors are forced to spend more time staring at a screen typing than actually looking you in the eye.
Yeah, the modern medical visit often feels like data entry with a side of healthcare. The doctor really wants to treat you, and you want to feel heard, not just, processed like a barcode.
Right. Which brings us to the first of the three assistants we're looking at today. Meet Art. Art is the AI scribe for clinicians. And according to the sources, Art is powered by Microsoft's Dragon Ambient AI technology. It just sits in the background, listens to the doctor-patient conversation, and generates structured clinical notes in real time.
The really key word to focus on there is ambient. We aren't talking about old-school dictation software here, where the doctor has to speak to a machine, like a robot, loudly announcing, comma, new paragraph, patient presence with fever, period.
Yeah, that always felt so unnatural.
Ambient AI is far more sophisticated. It just listens to the natural, messy flow of a human conversation.
But how does it actually tell difference between medical data and just normal small talk? Like if I walk into the doctor's office and say, my knee has been aching for 3 weeks, and also, hey, how's your daughter's soccer team doing? How does it filter that out?
Well, the underlying model is trained to recognize the acoustic signatures and linguistic patterns of clinical information. It essentially maps the conversation against a vast dictionary of medical terminology and diagnostic criteria.
Okay.
So when you mention the aching knee, it categorizes that as a chief complaint. When you mention the soccer team, the system recognizes a lack of clinical relevance and simply discards it. It translates human rambling into a polished, structured medical chart instantly.
The time savings mentioned in the article are just wild. It says nurses using Art are writing their end-of-shift notes 85% faster.
85%, that's huge.
And physicians are saving up to 30 minutes per shift. Plus, Art even suggests relevant clinical codes for billing, and it learns individual user preferences, so it adapts its writing style to sound like the specific doctor using it.
Yeah, it completely absorbs the immense administrative burden so the human professional can actually focus their cognitive energy on empathy and the physical examination.
I do have to push back here, though, because human bodies are complicated, and medical terminology is incredibly dense. What if the AI mishears something crucial during a complex diagnosis?
It's a very valid concern.
Like, what if you say you are experiencing hypotension and the machine hears hypertension? Or what if the patient has complex comorbidities, meaning they have multiple overlapping diseases acting up at once? A transcription error could literally be a matter of life and death.
It is a completely valid concern. But because the system is trained on those 16 billion encounters, it is highly adept at capturing context. It isn't just transcribing words blindly.
Oh, so it reads the room, essentially.
Right, it understands the clinical narrative. If a patient is diagnosed with hypotension, the AI expects the surrounding conversation to involve symptoms like dizziness or fainting. If it transcribed hypertension but the context points the other way, the system recognizes the anomaly.
So it basically flags its own confusion.
Yes. The system actively highlights any discrepancies it finds between its own interpretation of the conversation and the actual data. Most crucially, Art only generates a draft.
Ah, okay.
It requires a mandatory manual review by the clinician before anything is actually finalized. The doctor is still the definitive author. Art is just the ghostwriter pulling the first draft together.
But wait, if the AI is saving the doctor 30 minutes a shift, isn't human nature going to eventually take over? Like, aren't exhausted, overworked doctors just going to start blindly clicking approve on the AI's draft without meticulously reading it? How does Epic solve the human complacency problem?
That is easily the greatest risk of automation in any high-stakes field. Epic counters this by intentionally inserting friction into the design when it really matters.
Inserting friction.
Yeah, the interface actually forces the clinician to verify specific high-risk data points like medication dosages or severe allergy warnings before they can even sign the note. It refuses to let the doctor go on autopilot.
Okay, so Art has written the perfect clinical note. The doctor manually verifies the critical points and signs it. But that signature isn't the end of the line. It's really the starting gun for the hospital's massive financial machinery. Because if that note isn't coded perfectly, the hospital just doesn't get paid.
Oh, absolutely. The revenue cycle. It is the invisible, highly complex plumbing of the hospital system, and it is fraught with costly errors.
Here's where it gets really interesting. Meet Penny. Penny is the revenue cycle management assistant. The moment the doctor signs that note, Kenny jumps right into action.
Right.
The AI analyzes the billing codes, it identifies any missing documentation required by insurance, and it even automatically generates appeal letters for denied insurance claims. It also prioritizes which claims the billing department should focus on based on the probability of them actually getting paid.
The efficiency gains here are substantial too. The article notes that early adopters of Penny have seen a 20% reduction in days in accounts receivable.
Let's clarify accounts receivable for a second. That's essentially the money that insurance companies owe the hospital but haven't paid yet because they are, arguing over paperwork.
Correct. Reducing that delay provides a massive injection of cash flow for a hospital system that might otherwise be waiting months to get paid for surgeries they've already performed.
But I have to ask, does an AI debt collector actually help the listener? If I'm an everyday patient, I don't really care about a hospital's corporate cash flow.
It absolutely helps the patient, and it really comes down to reducing friction in your own life. Have you ever received a medical bill in the mail that made 0 cents or been charged out of pocket for something because the hospital's coding was just slightly off?
Oh, far too many times.
And then you had to spend 3 hours on the phone listening to horrible hold music trying to fix it.
Yeah, it's the worst.
Well, Penny's efficiency directly decreases those billing-related phone calls from confused, angry patients. The AI catches and fixes the coding errors before the bill is ever sent to your house. But the absolute biggest benefit to the patient is how Penny tackles the nightmare of prior authorization.
Oh man, just hearing the phrase prior authorization raises my blood pressure. For anyone lucky enough not to know, prior authorization is when your doctor says you desperately need an MRI, but your insurance company says, hold on, prove to us it's medically necessary before we agree to pay for it.
Right, and historically, this involves human staff faxing hundreds of pages of medical records back and forth with the insurance company, sometimes delaying critical care for weeks.
It's agonizing.
But Penny automatically gathers the required documentation, submits it, tracks the progress, and over time actually learns the specific requirements of different insurance payers to speed up those approvals.
Wait, how does a bot actually get better at navigating insurance bureaucracy? What is the learning mechanism there?
It analyzes the historical data of thousands of denied and approved claims. If an insurance company consistently denies a specific knee surgery, unless the clinical note explicitly includes the phrase, patient failed 6 weeks of physical therapy, Penny learns that algorithmic rule.
Oh, wow.
Yeah, so the next time it submits a claim for that surgery, it scans the doctor's note for that exact phrasing. If it's missing, it alerts the hospital staff before submitting. It entirely removes the human bottleneck, meaning you get your necessary treatments drastically faster.
Okay, so we've got the doctor looking at the patient instead of a screen, thanks to art, and the hospital is actually getting its money from the insurance companies, thanks to Penny. But eventually, the patient leaves the clinic and goes home, and they usually go home with a lot of questions.
This is exactly where the technology steps out of the hospital's back office and right into the patient's living room.
Meet Emmy. Emmy is the AI patient assistant built directly into MyChart Central, which is the portal most patients use on their phones to look at their medical records. According to the AI 365 piece, Emmy is designed to answer questions, schedule appointments, clarify your medications, and crucially, explain your lab results in plain language.
Medical portals have given patients unprecedented access to their own data, but access does not equal understanding. I mean, seeing a red flag on a blood test that says elevated leukocytes is absolutely terrifying if you don't know what a leukocyte is.
Yeah, you instantly assume the worst.
Exactly. Emmy steps in to translate that dense clinical jargon into human terms, instantly explaining that your white blood cell count is just slightly high, likely just fighting off a minor infection.
And it uses that massive Cosmos database to provide evidence-based info. If you ask Emmy about what you should expect during your post-surgery recovery, it isn't just pulling a generic result from a search engine. It's giving you tailored advice based on millions of similar real-world cases.
It's highly personalized.
Plus, Emmy is multilingual. It adjusts its tone based on what you prefer, and it can send proactive alerts. Like, it might text a diabetic patient to remind them to check their blood sugar.
It really shifts healthcare from a purely reactive model, waiting for you to get visibly sick and call the doctor, to a proactive model gently nudging you to stay healthy.
But do you really want to text a bot when you are anxious about a scary lab result or when you are feeling genuinely unwell? I mean, where is the bedside manner? There is something very cold about a machine telling you not to worry about an abnormal biopsy.
If we connect this to the bigger picture, we have to look at how healthcare systems are currently functioning. Right now, if you are anxious about a lab result and you call the clinic, you don't get a comforting doctor on the line.
No, you definitely don't.
You likely sit on hold for 45 minutes just to leave a voicemail for a nurse who is already overworked, and they might get back to you in 2 days. The current human alternative isn't exactly warm and fuzzy either.
That's a very fair point. It basically clears the traffic jam so the ambulance can actually get through. By having Emmy handle the mundane stuff, you ensure that the human staff actually has the bandwidth to jump in when a patient is genuinely scared.
Exactly the intent. Emmy operates on a hybrid model. It handles the routine, easily answerable tasks, clearing out the massive volume of basic questions clogging up the call centers. But the system is strictly designed with hard escalation protocols.
Hard escalation.
Yeah, the moment a patient reports a concerning symptom or an issue crosses a threshold of complexity, Emmy immediately routes the conversation to human triage staff.
Okay, so we have these three deeply embedded systems, Art, Penny, and Emmy, rewiring the entire experience. But if a digital brain is basically running the hospital's charting, billing, and patient communication, who is watching the AI?
Compliance and oversight are really the make-or-break factors here. Healthcare is a highly regulated industry for incredibly good reasons. Epic emphasizes strict compliance with privacy standards, leaning heavily on Microsoft's enterprise-grade compliance certifications to ensure the data is completely locked down.
But what about the AI just making things up? We've all seen stories about chatbots confidently inventing historical facts or citing fake legal cases. In medicine, an AI hallucinating a symptom or a treatment plan could be catastrophic.
Epic has built stringent guardrails into the architecture to prevent hallucinations. For instance, Emmy's responses to patients aren't just generated out of thin air by some creative algorithm. The parameters of its advice are vetted and structured by human medical librarians.
Medical librarians, I didn't even know that was a profession, but I'm very glad they are there making sure the bot doesn't recommend, drinking bleach for a cold. And the sources also mentioned that every single AI action has a detailed audit trail. How does that mechanism actually protect the patient?
An audit trail means that every prompt given to the AI, every draft generated, and every piece of medical advice translated is permanently logged and versioned.
Okay, so there is a paper trail.
Right. If an error does occur, the hospital isn't forced to throw its hands up and blame a mysterious black box algorithm. They can trace the exact root cause of the error down to the millisecond to see whether the AI misinterpreted data or if a human clinician irresponsibly approved a faulty draft. It demands accountability.
And this all points to Epic's future roadmap. They aren't stopping at clinical notes and billing appeals. The sources indicate they're looking at using this tech to predict patient deterioration before it even happens.
Which is incredible.
It is. They want to flag complex medication interactions and to optimize hospital staffing levels so there are always enough nurses on the surgical floor. There's a great quote in the article from Epic's founder Judy Faulkner that states, "AI is a tool to augment, not replace, human judgment."
That philosophy has to be the bedrock of all this innovation.
It makes me think of an exoskeleton. You strap on this robotic suit, and suddenly the human is stronger, faster, and capable of lifting heavy things without breaking their back. But the suit doesn't know where to go.
Right.
The human inside is still the one deciding to walk and still the one steering. The AI just takes the crushing weight off their shoulders. So what does this all mean? When we look at this massive shift in healthcare technology, what is the real takeaway for the listener?
This raises an important question about our expectations as patients. Healthcare has always been a deeply human endeavor, but the administrative bloat has alienated us from our providers. The introduction of tools like Art, Penny, and Emmy isn't about removing the human from the loop, it's about removing the friction.
Getting the paperwork out of the way.
Exactly. With those detailed audit trails and the mandatory manual reviews, the technology is proving itself to be a reliable partner. It forces us to demand more from our healthcare system, expecting speed and accuracy, but also expecting our doctors to finally have the time to actually listen to us.
We've gone from the mind-bending scale of 16 billion data points generating perfectly safe synthetic patients to Art saving doctors precious minutes in the exam room. We've seen Penny fighting the exhausting insurance battles by literally memorizing the bureaucracy, and Emmy translating terrifying lab results into plain English.
It's quite the journey.
The overarching value here is a shift toward a more efficient, patient-centered system, one that treats you like a human being in need of care rather than just a paperwork bottleneck.
Before we wrap up, there is one final, deeply thought-provoking concept that builds off what we learned about Penny.
Oh, I love a good thought experiment. Lay it on me.
So we learned that Penny is actively learning the specific rules and requirements of different insurance payers to get prior authorizations approved faster, right? It's studying how insurance companies operate to beat them at their own game. Well, if hospital AIs are getting smarter, faster, and more aggressive at navigating insurance rules to fight for claim approvals, it is highly likely that the massive insurance companies are going to deploy their own proprietary AIs to manage and scrutinize those incoming requests.
Ooh, wow. I didn't even think of that.
Will the very near future of our healthcare essentially be two highly advanced bots, one representing your hospital, one representing your insurance company, aggressively negotiating the medical necessity of your treatments in milliseconds, entirely behind the scenes?
That is wild. It's like high-frequency trading algorithms on Wall Street, but instead of trading stocks, they are trading the approval for your knee surgery. That is definitely something to mull over the next time you're sitting in a waiting room.
Absolutely.
So the next time your doctor spends the whole exam looking into your eyes in such a laptop screen, you might just have a bot to thank for it. Thanks for joining us on this deep dive. We'll catch you next time.